If one has a metabolic panel done, they may see a specific test known as an A1c Levels test conducted. So let's break down how this test differs from a standard blood glucose test. Now, A1c may also be labeled as hemoglobin A1c or HbA1c, and this gives information on one's blood sugar levels over time, about 2 to 3 months. And that's because these tests are looking at one's red blood cells, or specifically hemoglobin on those red blood cells, and the sugar or glucose that's attached to it. So this gives information on one's blood sugar management over those period of different months, not at one specific time. So when a blood sample is taken and one gets A1c levels measured as well as blood glucose levels measured, there can be a few different scenarios that one could have. First could be healthy blood sugar levels and healthy A1c levels. However, they could also have a second scenario where there's elevated blood sugar levels but healthy A1c levels, meaning that over time their blood sugar has been maintained, but at that specific time they had elevated blood glucose levels, maybe due to a recent meal. There can be another scenario where one has healthy blood sugar levels but elevated A1c levels. So that means at that specific time, maybe they were fasting for that blood glucose test, so that we didn't see as much blood glucose at that specific time. However, when we looked at their red blood cells, over the past several months, they did have a lot more glucose attached to their hemoglobin. So this gives information as a complementary tool with blood glucose levels in order for one to better manage their prediabetes, diabetes, or just their overall health related to their glucose levels. So make sure to stay connected to my channel and with Dane Garvin as we continue to keep you informed about common therapeutics as well as common tests.